ACL reconstruction is a common and successful surgical procedure. ACL reconstruction is indicated in patients who have sustained a complete ACL rupture. So the anterior cruciate ligament is the ligament that crosses the knee and attaches to the front of the knee. In patients who have a complete ACL rupture, who wish to return to pivoting sports such as skiing, football, martial arts, ACL reconstruction is indicated. The preferred method of reconstruction traditionally has been the bone patella tendon bone graft choice. In this procedure, a piece of bone from the middle third of the patella, the adjacent patella tendon, and a piece of bone from the tibial tuberosity is utilized. At surgery, the knee is examined under anesthetic. In a patient with a complete ACL rupture, the knee will be lax. The knee will feel lax with a positive anterior draw test and Lachman's test, and a positive pivot shift test would be confirmed during surgery. The surgeon will perform knee arthroscopy, where he will confirm that the ACL is completely ruptured. Assuming the patient has an isolated anterior complete cruciate ligament rupture, the various anatomical landmarks within the knee is identified using keyhole techniques, and this is a crucial part of the surgical procedure because the surgeon is attempting to reconstruct the native ACL, and a tunnel is drilled in the shin bone and the thigh bone in the appropriate locations. The graft is then passed through the shin bone, the tibia, onto the thigh bone, and is secured with a fixation device which may consist of a screw or other fixation techniques that will ensure that the graft is stable and attached within these tunnels in the thigh and shin bone. At the end of the procedure, the surgeon will very carefully assess for stability in the knee to ensure that the ACL is correctly aligned and correctly reconstructed for the patient. It's important to note that ACL reconstruction will only ever be successful if the patient complies with a prolonged period of rehabilitation after surgery. If patients are not compliant with ACL rehabilitation, there's an increased risk of re-rupture either in the reconstructed knee or in the opposite knee. It's important patients are very carefully prepared before surgery to ensure that they would be able to comply with such exercises, not just before but after surgery, for several months after surgery, to minimize the risk of recurrence.